Tell us about your experience. You've got the complex regional pain syndrome, the CRPS1. You and I have been dealing with this in my realm in dental world for what, 2.5 years now? 3 years?
Almost 4.
Yeah. So things got out of control about a month plus ago, right?
Yes.
Tell us the story and tell us what you did.
Yeah. There are a couple of elements that I think all contributed to make this perfect storm.
Yeah.
Work was crazy, and so there was a lot of stress and long hours, and you're not sleeping great. And then I had an old crown that was performed by another dentist in the upper left back that started disintegrating, and all of a sudden my mouth would be filled with tooth shrapnel.
Yeah.
And it wasn't causing any pain, and so...
But it was breaking apart.
But it was breaking apart, but I had these 2 crazy weeks at work, and I thought, just get through it.
Yeah.
And then made it through that, and it continued to disintegrate, but now it's starting to cause some pain.
Yeah.
At the same time, my CRPS since the diagnosis in 2017 has been for the left side of my face, jaw, teeth, and now we have suspicions that it has also spread to my right hand.
Yeah.
And I was starting to lose functions. I couldn't pick things up, the swelling, the discoloration, the hypersensitivity. So my doctor wanted me to see a nerve doctor to do a nerve conduction test and an EMG. And I had heard from other CRPS patients, don't do the EMG. Worst experience of my life. I screamed all the way through it.
They stick needles in.
But they stick needles in.
Yeah.
So I do the nerve conduction test. It's fine, like a TENS unit.
Yeah.
And then I said, look, I have real reservations about doing this. And they said, oh, we have different needles. It's more like an acupuncture needle. I'm thinking, well, I get acupuncture every week. That shouldn't be a problem.
Mm-hmm.
And I was so close to screaming bloody murder. And
It was bad.
the bruising that actually occurred down my arm from that looked like I'd been beat with a baseball bat in every needle injection spot.
Yeah.
So we had that on top of now this tooth pain. So now
Did that set things off in your hand? Did it make it worse?
it was already hurting, but now it's really mad at me.
Yeah.
So then when we come in to talk to you about the tooth,
Yeah.
your view on it was the amount of damage that was actually done to that tooth should in no way have caused the level of pain that I was feeling. And it was the pain.
It was an old porcelain and metal crown, and you were just chipping off porcelain.
Yeah.
It's not that big a deal. Yeah, but you were actually symptomatic, and it was sealed. It's really unusual. It shouldn't have been bothering you. When I took it off,
shouldn't.
it was clean.
Which is another question of if I really needed it in the first place. So when we make the decision to move forward, we always know that there's a risk.
Yeah.
And I appreciate every step that you guys took to minimize.
We did everything we could to help prevent.
Absolutely.
Yeah. Yes, but so then we took your crown off and we built you a CAD/CAM crown. Same day, no temporaries, it was fast. We hit you with neck blocks, we hit you with ozone. We hit you with the laser energy, the neodymium side of it, to help calm down the sympathetics. But it still blew on you, didn't it?
It did that night.
Yeah.
So, and I left here thinking, we're good.
Yeah.
You know, I knew there was going to be a little bit of ache, but anytime you do work, there can be a little ache. And then that night, it started to scream.
Yeah.
And in conjunction with my hand screaming, now I can't sleep. And I go that week and I'm just, it's an indescribable level of loneliness and just this hopelessness when things hurt, you can't touch anything, and there's nothing you can do to resolve it. My sweet mother, like I called her and she just came and...
You can't take meds for this.
No.
There's really nothing you can do for it.
I mean, she came and just laid in my bed and held me while I cried.
Yeah.
So then Thursday she said, come to my house Friday for a change of scenery. And on the drive to her house in Rogers, I get a flare-up that's close to a 10, and it's just miserable. So I changed direction and actually drive to the hospital. And as soon as though I get into the hospital parking lot, the flare starts to temper off. And so I'm thinking, I can't go into the emergency room if I'm not at a 10, because they'll look at me and they'll think I'm a junkie and I'm just looking for a fix. So I went to Mom's instead, and the level of pain just continued to grow, and we were doing everything we could at home to try to calm it. And thankfully, that's when you guys said, "Come on in here, let's try again." And then
So we did a neck block and we did the laser.
Yeah.
Yeah. Did it help that time?
We didn't even make it home before it started to.
So it didn't help.
It did not help.
That's the first time.
Yep.
Yeah, of all the times, what have we done it probably 14, 15 times?
Oh, absolutely.
And I don't think we've ever had a time where it didn't help.
Nope.
Yeah.
And
Wow.
that created a level of fear because it's always worked.
Yeah.
Like something should have happened. So then you had commented, I guess, to my mother, I don't remember this.
Ketamine.
To ketamine. See if anybody even does it. So we Googled that night, and there's a ketamine clinic in Johnson.
Yeah.
Called Ketamine Clinic of Northwest Arkansas.
Yeah.
We're on their website. They don't require a referral. You just go by however many sessions you need to do to pay.
Yeah.
So I emailed them and just said, "Here's my information. Would I be a considered patient?" They contacted me that night, Friday night after 6 p.m.
Oh, wow.
One of the anesthesiologists starts texting me. She said, "Come in Monday, we'll do your intake session, and if all is good, we'll immediately follow it up with your first infusion."
Mhm.
And I was like, "Oh my gosh, this is amazing."
So what was it like?
Clinic is great. It's run by these two anesthesiologists. So the intake session is really just a formality for the doctor to order the meds for you.
Yeah.
The the infusion itself is trippy. I told the girls up front, I don't think I can say that I've never been high before now, because it is out of this world. It didn't necessarily immediately stop the pain in those 2 hours, like it's just trying to flood my system. But we did 3 the first week, and then we did 3 the next. And after each infusion, there's a level of, you're going home and it doesn't hurt. Okay, how long now does it last? It's a little bit longer. It's a little bit longer.
What did you get out of it the first time? An hour or two, or a day or two?
The
or what?
first, I probably made it to bedtime
Without any pain?
with either very minimal that can be controlled with like an Advil or a Motrin.
Was that similar to like when we used to get neck blocks and it was working for you?
Similar.
Yeah, that kind of almost turned off.
Like almost, it's just a little.
But we were getting
bit
it to where it was
echo.
10, 14 days.
Correct.
And then the last time didn't do a thing.
No. And,
Yeah.
but I also know that I'm dealing with a level of pain in this instance that is like out of this world. So we would do pain level, start, finish at each infusion.
Yeah.
I don't know what the measure is, but I guess I started at 100 of ketamine. We ended at a 300.
Is that high for what they're doing?
It is. Most of their patients are actually for depression and anxiety,
Not for CRPS.
not for CRPS. So
But they have some patients, don't they?
they saw 2 the same week as me with CRPS.
Yeah.
So it's.
Head and neck grips or different parts?
She didn't say, and it was HIPAA, so I didn't want to pry
Yeah, of
too
course. Yeah.
hard.
Yeah, yeah.
But had multiple in that week, so they're almost as anxious to see how it works for the pain side, because that wasn't their intended audience in the beginning. What they have also prescribed for me is a month's worth of Troches.
Yeah.
So
Ketamine Troches?
yes, so the lab right next door to them in Johnson made it in a couple of days, and my instruction is if I am hit with pain and I can't calm it down with an aspirin,
Yeah.
quarter the first dose and just take a quarter.
Yeah.
And then continue to increase just so we find out what's the minimum amount that can quiet it out. If I can make that last year, they recommend coming in about every 6 to 8 weeks to do another round, just to
One infusion or?
one infusion. Each
So it
infusion
really
is
did
about
work for
2
you.
hours.
So how many infusions you go through?
I did 3 one week, 3 the next.
So 6.
Yep,
After the first one, and it took the pain down that night, but then it came back the next day.
correct.
Then each subsequent one, you got a longer stretch without
I got a longer stretch, and my overall entering pain was less.
Okay, so now here you are, how long since you had the last one? The sixth one.
Thursday of last week.
How you doing today?
I've been good today. I took a nap this afternoon and woke up and had a little bit in my mouth, but I've taken some aspirin and it's
Knocks it out.
echoed, but it's still a little bit there, but it's not painful. You know, for the most part, I've learned to live at a 4 to 5. That's
So
most
that's
of my
almost a 1 to
days.
you, or a 0. Yeah.
Yeah, so it's not that I can't function
Yeah.
at that point, but one of the things is the nerve test on my hand did reveal that I have moderately severe carpal tunnel. So the doctor has now said if you don't have surgery, you will have permanent nerve damage in your hand. But if you do have surgery, they can fix that, but we don't know what it's going to do to the crypts. So that's
scary.
a very hard and difficult decision that I'm.
What are you doing that's causing the problem?
What triggers
tunnel?
it?
Yeah. Are you typing all the time? What?
No, I mean I work from home, but I don't.
Yeah.
And it came on fast.
Yeah.
So it's very chicken and the egg. Is
Yeah.
what's making what mad, and I don't know that yet. So I meet with the surgeon on Wednesday, and I'm going to talk to him about his experience with crypts. It's such an easy surgery. I saw a YouTube video of it in 90 seconds.
So is taking your crown off.
Yep. And
Yeah.
I don't know about that. The anesthesiologist told me when I meet my anesthesiologist to not direct, but mention casually, hey, I just finished a successful round of ketamine. Would you mind putting some in my bag?
Yeah.
And she said that might also help with my hand.
Before Dr. Piper does TMJ surgery on CRPS patients, you know, in the TMJ surgery world, he always has the anesthesiologist use the ketamine
Okay.
as part of the cocktail.
Really?
That's a universal.
Wow.
I don't know that he does it for every patient, even if they don't have the CRPS, but if they have even a hint of it, he has it in there.
Okay.
He orders that.
I'm a believer.
My
in
advice
it.
would be say no unless they will do that for you, or don't do it at all.
Yeah.
Either or.
It's
So-
scary because I'm right-handed.
Yeah.
And one of my favorite hobbies is baking bread. And
You want to really do that? Yeah.
as a test, I was feeling really good yesterday, and 2 days ago. I was like, okay, I'm going to try it. And I did, and it started barking and yelling at me.
Yeah. Wow.
So I don't know. I don't know what fixing it would do, but I don't know what fixing it would do.
Are you glad you did the ketamine?
Yes.
That made a big difference.
Yes, it did.
It was the only thing to turn it off, wasn't it?
Mm-hmm.
Wow.
And I think it let me sleep, and all of these other pieces I'm on.
Lack of sleep's a problem.
Yeah, and I'm
That
on
ramps it up.
PTO, no work stress. Like,
Yeah.
I know that there are other lifestyle factors that
Yeah.
I need to make changes, because if I don't, I will lose my quality of life to CRPS.
Yeah. And to be clear, most people, most physicians don't think that CRPS happens in the head and neck.
No, they don't.
And that's exactly where it started with her. So that's an important distinction. The hand, the extremities, the trunk, not common, but it's an uncommon problem, disease, and it's a syndrome, so they don't really know what causes it, other than ramped up sympathetic tone, autonomic sympathetics. And this kind of sucks for her. But thank God she's got something to help knock it down now.
Yeah. I mean, it's not inexpensive, but I've talked to other CRPS patients on discussion boards, and it's a third of the cost of most of what they have to pay in other places. So
So you got lucky by living here.
I do,
That'll work.
especially if you compare it to the
Insurance doesn't pay for it, do they?
no,
I didn't figure. Yeah.
the Spiro Clinic. If you
Yeah.
compare it to what Katinka's charging
Yeah.
versus the ketamine, I'll pay the ketamine.
The ketamine was,
It's $450 per session.
that's not cheap. How long does
No.
it take?
2 hours.
Huh.
Well, 2 hours to do the infusion. I was there usually 2.5.
Well, that's a lot of time. I guess that's not so bad. I mean, do they have multiple people in there?
Mhm.
Oh, they must. Yeah, right. Interesting. Okay.
But they're very good about staying with you.
Yeah.
I told the girls, my mother has videotapes of me interacting with my hallucinations. I mean, when I say that it's
You were tripping.
trippy, I was tripping. So everybody had a good laugh.
All right, turned you into a junkie
I know.
by recommending the ketamine.
And it was so bad.
Oh, okay.
It was good.
Yeah.
So, I mean, I'm almost done out of being stuck 9 times, and
Are they doing it?
One anesthesiologist prefers the hand, one prefers the crook. But the one who prefers the crook went to my hand each time first and couldn't thread it. So I got stuck 9 times for 6 IVs. Which is why Dad doesn't go to those appointments with me.
Dang. All
That's
right.
lots of needles.
Well, thank you very much.
Hey, thank you.